or in your NCLEX exam, it's going to be easier for you. Okay? So continue doing your practice. And now we only have 75 and 145. So don't be lazy. All right, so we have herbal medication. So one of the herbal medication you could actually use in order for you to be stimulated, all right, in order for you to be always awake when you are studying, because it doesn't matter what kind of medications you're taking. For example, they say what medication you need to take in order for you to memorize or to gain that, to be able to remember most of it. Ginkgo Biloba. And Ginkgo Biloba is one of the herbal medications that was being stated in our NCLEX exam, or Alzheimer's patients are taking Ginkgo Biloba. All right? But always remember, it doesn't matter if you're awake, if you're taking Ginkgo Biloba, if you are stimulated but you're not studying, it doesn't work, right? So you should be, those medications can make you stimulated, meaning you're awake, you're hyper, and it's time for you to use that energy by reading or answering questions. And that's how you're supposed to do it. Okay? So let's start with some of the most important hints for your herbal medications. Pregnant women are usually not allowed to take medications, and we know that, right? So once a patient is pregnant, well, we don't ask them, are you pregnant? We always ask them, when was your last menstrual day? All right? So once we found out that they are delayed, so we don't want to give them any medications unless the doctor is going to prescribe them. Okay? So, and we also said, once this woman is going to be delayed or pregnant, we want this woman to take some medications to enhance and prevent problems on neural tube defects, as well as cleft lip and cleft palate. And that will be, what vitamin B is that? What vitamin B is for prevention of cleft lip and palate? It says B7, B12, B6, B9, right? So your folic acid is B9. So that's why we said in our discussion, we said a woman should take multivitamins daily. Why? Because B9 is in multivitamins. So if you don't see B9 in any of your choices, the best answer is multivitamins, because everything else is in the multivitamins. All right? So in fact, some of the multivitamins has its herbal medication mixed with it as of this time, right? But a lot of other manufacturers would not do that, because there are other effects that could enhance the problem or side effect. So there are medications and prescribed medication and herbal medication that is not supposed to be combined, all right? So one of the things that we usually do in Asian culture, we want to take bitter melon if we have diabetes mellitus type 2, right? So, and most of the promotions in pharmaceutical company in Asian countries is combining a metformin with a bitter melon. Why bitter melon and metformin? Because they believe that metformin lowers your blood sugar, and also bitter melon tablet or capsule could also lower your blood sugar. But we don't want to do that in United States, all right? Because if you combine both that will lower your blood sugar, what will happen to you? Yeah, you're going to be super hypoglycemia. Your side effect is so bad, and we don't want to have that interaction. We don't want to combine that medication. Let's talk about that medication that we discussed last week. And we said grapefruit as one of the herbal medications. But I want to ask you, is grapefruit a herbal medication? Yes or no? What is that an herbal medication, or is it just a fruit? It's a herbal medication, all right? And grapefruit can decrease your appetite to eat. Okay, have you tried eating grapefruit?
Yes.
Usually we eat it here in a can, right? So otherwise, what's the taste of that particular grapefruit? What's the aftertaste of grapefruit? Bitter, right? And you don't have the appetite anymore to eat. Isn't it? So that is why your appetite stimulation is gone. All right, so that is the effect of that particular grapefruit. But the problem with grapefruit, if you are taking calcium channel blockers, Buspar, statin medications, that particular medication can enhance its potency, which is supposed to be good, right? But it's going to be bad because if I'm taking calcium channel blocker, like what's the brand name, nifedipine, for example, I took nifedipine medication and that's 50 milligram. I eat my grapefruit, it becomes 100 milligrams because it's going to increase its potency. So what will happen to my blood pressure? It's going to be super low blood pressure. All right. So we don't want that in our patient because we might find out our patient on the floor when we come back to the room. All right. So those are interactions that you have to remember. So let's start with one of the herbal medication. We call that cayenne. All right. Cayenne, or other words, peppers. All right. We have hot peppers. We have sweet peppers. All these peppers are herbal medications. And what is the usefulness for the peppers? Hot peppers are usually used for external purposes, and they should apply into the skin mixing it to the oil, as for example, like a liniment applied to the skin to relieve pain in your patient. But the problem is it can cause GI tract issues. All right. So some people are very sensitive to peppers. All right. I don't know if you can tolerate. Some of them will have diarrhea after eating too much of that particular herbal medications, all right, or that particular vegetable. So the other one also that you're going to understand, because it's too hot, applied to your skin, then your skin will be burned, and we call that blistering in there, okay? So right there. So other issues we have, one of the common medications that you will see there as an herbal medication is Echinacea. Echinacea is actually came out in your NCLEX exam to enhance immune system. And one of the examples that we've seen in the actual NCLEX exam is an HIV patient. So it says there, a patient has HIV. Which of the following herbal medications should be taken by the patient to promote immune system? And among of those patients listed, of course, HIV is, we always think that HIV could be immunocompromised, but they are potential to be immunocompromised. We don't call HIV patient as immunocompromised until we will see that their CD4 level is below 200, right? So always remember that. There is an HIV patient is normal immune system, and this is stated in your NCLEX exam, HIV with CD4 level below 200. What is the normal CD4? 400 and above. All right, so 400 and above, that's our current practices. But what we have in patient diagnosed with HIV. So if a patient is diagnosed with HIV, the 400 and above, that's acceptable on their level. But if you're a normal individual without HIV, the most common normal we've seen in our textbook is 600 to 1200. That's your normal CD4 level. But again, they will not usually ask you what's the normal. They will ask you what will happen to the patient with below 200, right? In fact, if you go to vaccinations in CDC guidelines, you will see there which among of these particular vaccinations should not be given to patient with CD4 below 200, right? Measles is one of it, because anything that is live vaccine should not be given to patients who are immunocompromised, all right? When your spleen is removed, do you think you are immunocompromised? Yes, all right? So some of the questions of the NCLEX exam, it was about which organ is affected, and there's absence of spleen because it was already removed. So that particular patient could be your immunocompromised patient, okay? So Echinacea enhances your immune system. So if you want to buy medication right now to enhance your immune system, because right now we have flu and we have our COVID-19, and I think right now in East Coast or colder places, they develop now flu manifestations, all right? And there's an increase of COVID-19 cases already. So it's scary. So we don't want that it will be the worst winter season for United States. Or maybe not only United, maybe the whole world, if ever. So we need to enhance our immune system. We take these medications, but again, what's the bad effect of this? It can cause liver damage, right? So again, herbal medication and prescribed medications are basically have several same side effects, all right? But then why is it that we cannot really claim the good effect of herbal medications? Because there is no study that is being conducted to it, right? If you buy that box of herbal medication, it says there that it cannot be claimed, right? So it's up to you to believe it or not. It's up to you to take it or not because the claim is not proven. Okay? So, but that's why we said, which medication do I have to take? Do I have to take the medication prescribed by my doctor or I will just buy over the counter? I would rather buy the ones that is being prescribed by the doctor because if I had something that I will encounter a side effect that could damage my system, then I can claim because that is, it's being proven that that's a good effect, but there's also a bad effect for that medication. That's why you can file a case against those pharmaceutical companies, right? So the next one is Epidranipitra. It's one of the medication that suppress your appetite. So if you don't want to gain weight, then that's the medication or herbal medication. Otherwise, stop eating. That's the only way not to gain weight. All right, but how? Right? Especially nowadays, well, we are mostly teleworking, facing our computers and eating at the same time. Right? So I told Walter, starting last week, we are not supposed to eat rice. So we have to change our diet to meat and vegetables and fish. I tried my best. I hide the rice. Can you imagine? But then, yeah, we tried. We hide the rice. Okay. So what is bad in your patient with Epidra? Epidra can cause antidepressant medication that will lead into hypertension. So remember, antidepressant are a stimulant, and you shouldn't take Epidra and stimulant medications because Epidra can increase your blood pressure. All right, so that means Epidra in our system can stimulate. Okay, but the effect is not related to appetite enhancement, but decreased appetite, but it can cause problems in your blood pressure to increase. Okay, so again, it can also be used as asthma medication, and that was also in your actual NCLEX exam. Feverfew is for migraine, for rheumatoid arthritis, and anti-allergy, but the problem is that it can cause bleeding. All right. Most of our medications, especially herbal medications, are not good for patients with bleeding tendencies because they can enhance bleeding. Remember, one of the juice that you don't want to give to a patient taking anticoagulant. What is that juice again? That apple juice, or is that grapefruit, apple juice, orange juice, or cranberry juice? Which one can enhance bleeding? Cranberry juice. All right. So garlic, and we know garlic. A lot of people love to eat garlic. Nevertheless, they want garlic every day, and every time we cook, we have garlic. But the good thing with garlic, it can lower your blood pressure. It can also decrease your cholesterol. But the problem is, it can cause bleeding. All right. Remember in our discussions with 4Gs, right? At the 5Gs, we call that 5Gs. Those 5Gs in our GI irritant medications may cause bleeding. So make sure you master the 5Gs, including garlic, because you cannot combine garlic with Coumadin. You cannot combine any other medications like ginger with garlic and Coumadin, right? Because they are all bleeders. Well, what we have with ginger can decrease your vertigo and nausea and vomiting. And then in Asian culture, we also believe that ginger can enhance or can decrease the problem related to throat, right? So sore throat, for example, if you have that, you can drink some ginger or ginger hot tea, all right? But otherwise, in our NCLEX exam, we haven't seen that as one of the questions that says about sore throat, you drink ginger, all right? But most of the time, what they have is anti-nausea, vomiting, and vertigo, all right? Again, this belongs to 5G, so therefore, they will cause bleeding, okay? Ginkgo biloba, this is one of the things that we always say, I have to drink Ginkgo biloba because I'm studying right now. Maybe it's too late, or maybe it's just the right time, right? But as I've said, it doesn't matter if you're drinking medication that can stimulate your memory. If you're not studying, it will not stick to you, right? Same thing. If you don't practice, you don't read every single day, you will forget it. Don't read for 1 week and then answer question. You cannot answer probably. You cannot really get the right answer most of the time. That's why every single day read, answer questions, listen to the videos or watch it if you can. Otherwise, most of the time we have the time to listen to it. All right. So, but what is ginkgo biloba? It's a stimulant. All right. Can a patient with hypertension can take ginkgo biloba? No. What is the most common manifestations of patient taking ginkgo biloba? What's the most common complaints that you will receive from students who are taking ginkgo biloba? And they all always say, "I'm not gonna take that medication, Mr. George, because I almost died." Okay. Tachycardia or palpitation, right? Try to take ginkgo biloba and you'll have tachycardia or palpitation. You will not pass your NCLEX exam because you cannot take it anymore, right? So that's why when you're thinking of studying, make sure that you're awake. It doesn't matter if you take some stimulants, but at least you're awake and you're reading or studying. Because if you're just Facebooking, you remember all the stories of your friends, but not the NCLEX exam. Promise, right? You remember your other friends. My God, what an achievement! But did you did something today to achieve something for your NCLEX exam, right? So again, you have your ginseng. So ginseng is also a stimulant. So ginkgo and ginseng are a stimulant. Remember, most of our what you call that one energy drink. Are you familiar with energy drink? Monster, right? So monster drink are mixed with all stimulants that include ginkgo and ginseng. But that's why you become a monster because they are all stimulant. But what will happen to you when you take it? You're having palpitation and you cannot do anything, but you want to exercise. But instead of studying, you don't want to do that. So actually, you can take those energy drinks if you want to, little by little, so that you can be awake and you can be able to study. Because I believe that our modules, our books are the best sleeping pills. Right? The first page you open. I remember that before. Oh my God. And Walter's classmate was telling us, "Oh my God, George, I love the new Saunders book." I said, "Why?" "I read the preface." I said, "Oh my God, of all nurses who will be taking the entrance exam, that's your motivation, the preface, the story of that author. How can you finish this?" So he said, "Oh, you read the first page and the last page." Right? So you have to read the content of the book, each of the pages, so that you will be able to learn from it. Okay? So ginseng can increase your stamina and mental concentration. So the same thing with your ginkgo biloba. So either you take ginkgo or ginseng, the same effect, right? But if you're not going to really study or read, you can't remember anything either. Okay? So again, can you combine ginkgo and ginseng at the same time? In reality, you don't want to. You will have cardiac arrest, right? Same thing with those monster drinks. That's why before you take those energy drink, you should be taking a small amount at a time because you might get a good rush of energy, but you have palpitation. You will have chest pain. Remember, chest pain or palpitation or tachycardia are the same meaning. Okay. So ginkgo, ginseng, ginger, as well as your garlic is all about bleeders. So they will cause bleeding to your patient. So when a patient is taking anticoagulant medication, if you don't see Coumadin, what are other medications that are anticoagulant? Xarelto, Pradaxa, right? You remember your summary of your ECG, right? You have those patient with AFib, right? Atrial fibrillation is the only one in ECG that will clot. That's why we give them anticoagulant. We discuss about heparin when there is a procedure for AFib. We discuss about Xarelto, Pradaxa, and Coumadin as their maintenance, and they should not be taking these herbal medications, right? Work as a home health nurse, and then you will realize an Asian patient is hiding all those herbal medications, isn't it? And here comes the RN who is going to admit the patient in home health, didn't even ask the patient or a family member if they are taking herbal medications. Here comes the surveyor going to the patient's room And then, so all your Asians, so there's a lot of good herbal medications out there, isn't it? Oh, yeah, we have some. My mother is taking these herbal medications. Then, hello, we can find it now in your medication tracking system that you are not actually checking on other medications being taken by the patient. Other nurses, if I'm going back as a surveyor in home health, I can get a lot of problems because I worked in home health for how many years? I started as a QA, and then I became a visiting nurse, and then I became a DOM in home health for a long time, right? So can you imagine if I'm going to be the surveyor now in home health and following that nurse, I can write a lot of things that they are not doing, right? So, but I don't want to be going there anymore, right? Good thing I'm just training the surveyor so I can tell them this is what you're gonna do. All right. So we have one of the issues in home health. It doesn't matter the patient died in the hospital, but if the patient has not been taken care of by the home health nurse, that home health company will also be in having a problem. Right. So one of the examples that we have was the patient was having assessed by the RN, and the RN found out that there is a wound on the pit area of the patient. The LVN that follows up, so LVN makes sure when the RN is admitting a patient, you should call the RN if you're the follow-up nurse. All right. Remember, in the hospital, who is going to endorse to the patient to you? Whoever that nurse that take care of that patient. Now, if I am the RN and Sadie will be the LVN, Sadie should be calling me if the RN is not calling her, right? Because I'm going to visit her tomorrow. I want to make sure that your assessment is presented to me correctly with what type of wound care I should do, right? Remember, in home health setting, there is a middleman. The middleman is we call that coordinators in home health, right? So that coordinator will call the LVN after the RN is calling them. But remember, I will tell Cheryl now, and Cheryl will tell Arnold, there is some miscommunication already, right? Arnold will not get the full details of my story that I told Cheryl. So if I am the RN, I should be calling my LVN, or the LVN who's going to follow up should be calling me to find out what's going on, because the middleman will always miss something. All right. Remember, whose accountability, who is the nurse that will be going to court or jail, or that accountability will be for both of you. Right? So now, if you are the RN or LVN, make sure you have to look at your patient from head to toe. Same thing, if you're doing a wound care from the patient in home health care, you should be looking from head to toe as well. Do not just look at the nurse or the notes of the RN that says, oh, these are the only things that you have to do. But you don't want to you don't want to remove the sac of that patient on her right foot because there was no statement by the RN that there is a wound in there. And that patient died in the hospital because gangrene developed. Nobody opened that leg. And who is going to be in trouble? Both RN and the LVN. Because the LVN, oh, I don't see that. I don't know. There was no report about it. So can you imagine you are going there without looking at your patient? You should be really accountable. You should be accountable for all your assessments, because it doesn't matter RN assessed for the first time, but the daily assessment, if you're the visiting nurse in home health, you'll be the one doing your assessment daily for your patient. Okay, so again, what do we have here is our golden seal. So golden seal is used for laxative, and it's also anti-inflammatory medication, but it's a herbal medications. But bad thing for this herbal medication, golden seal, it can increase your blood pressure, and it might enhance swelling as well. Though it's anti-inflammatory, but it could enhance swelling, right? So the other one is saw palmetto, and I think we mentioned issues about saw palmetto, but saw palmetto, we call that a polycatheter, herbal polycatheter. So what does it mean? Saw palmetto reduces the size of your prostate gland. So intentionally, it is indicated for men for prostate health, all right? Because there is no prostate for women. Now again, what is the most common problem associated with prostate in our in prostate issue in men. One is a cancer of the prostate. The other one is a benign issues with prostate. So there are two types of cancer in your patient with prostate. One is benign, one is malignant. And the benign is the one that makes that prostate enlarge. We call that BPH. All right? So it's a benign, it will not kill you, but it will block the way you are going to urinate. All right? So that's why if you're taking sopalmeto reduces the size of the tumor. It's still a tumor, isn't it? It's just benign. So it's still a tumor, it is a benign in nature, and then it reduces the size. Remember, our options for treatment of cancer is by radiation and chemotherapy, right? We should be able to understand that radiation reduces the size. But in this case, since it's benign, we don't need radiation, right? We take this medication, sopalmeto, to actually reduce the size. So once the size is reduced, if you're looking at your patient with the ureter, right? If that's the ureter, and this is part right here is that is your prostate. So that prostate could push the ureter, then it will block the way you are going to pee. All right? What does the doctor will do is to perform PURP, isn't it? That's a surgical procedure to scrape some of it in here. Okay? You're gonna remove this part right here. So once you remove that part, then what happened now? There is no more obstruction. Now you can pee. All right? But that's a surgical procedure. So again, if you're taking this medication, you might not need that surgical procedure anymore, right? Because it will decrease the size and it will allow you to pee and your kidney will be working okay. Because the problem, if you can't pee, you retain your urine in the bladder, and what will happen if you retain your urine in the bladder? It will go back up, right? It goes back up to the kidney, causing problem to the kidney, and that will cause another cause of your renal failure. Okay? So that medication was presented in your NCLEX exam as an actual question, and it says there, doesn't say about BPH or prostate, but it says there which among of the herbal medication can decrease the size of the tumor. And that's the only one among the herbal medication. That's the only medication that decreases the size of a benign tumor in your prostate gland. All right? So they can make it as a general application to a tumor. It's still going to decrease the size of the tumor. Okay? So, again, you have your next medication. All right? So your next medication will be related to licorice. So the licorice is basically for stomach ulcers. So, but of course, we already know that we have a lot of medications for ulcers. Okay? So you have ranitidine, famotidine, cimetidine, all the tidines, right? We have prasol, ending of your medications. We also have our, what we call over-the-counter antacids, right? So our antacids has three categories or three types. One is made of calcium, one is made of magnesium, and one is made of aluminum. They can combine it all. They are all antacids, okay? And I don't know if you still remember, when do you take your antacids? Before meals or after meals? Tums, for example, you're familiar with Tums. So when do you take Tums? After meals, 1 to 2 hours. All antacids are taken 1 to 2 hours after meals because acid only increases after you eat. It doesn't increase when you are not eating. You have a natural acid, but it will not increase unless you eat. All right? So you take your Tums or antacids at least 1 to 2 hours after meal. Now, what about the rest of your other anti-ulcer medication? Prasol should be taken with empty stomach. Tidine should be taken during mealtime. So we'll discuss those medications in our gastric ulcer and then, of course, duodenal ulcer as well. Okay? But that's how you remember about anti-ulcer medication. Otherwise, anti-ulcer medication, as we discussed in our pharmacology from the previous days, we don't want to take them with our other medications because they are alkaline in nature. Alkaline medications can decrease the absorption of your medications. That's why take it after you take your best medications. For example, antibiotic first, before you take your anti-ulcer meds, right? Because what you're achieving, better absorption. Because if you're taking anti-ulcer first, then what's next, right? So it will not enhance its best absorption. Okay? So next one is your kava-kava. In Tagalog way to say that is kava-kava, kinakava-kavahan, right? So in other words, that means you're having palpitation or tachycardia. That means it's anti-anxiety medication. So if you go for kava-kava, St. John's wort, and valerian, they are all anti-anxiety medications, right? So the St. John, you have like thing in your head, right? Like a saint. So it will relax you. So basically, all anti-anxiety medication are relaxant in nature. Okay. Now again, since kava-kava, St. John's wort, and valerian, you cannot combine this with your ativan. So what do you think will happen to you if you take ativan and kava-kava, right? So you might not wake up tomorrow. You might need your benzodiazepine antidote. What's the antidote for all this anti-anxiety medication? It starts with letter R, romazicon. All right, romazicon. So that's always in your NCLEX exam, though, that particular medications. Okay, so well, make sure people or patients that are taking anti-anxiety medication should not take any alcohol because it can cause more problems to them. And they are not supposed to drive or operate machines. So anything that could make you weaker, you're not supposed to operate any machines because you will be in danger for accidents. Okay? So that's how you remember about those herbal medications. And then, of course, our last herbal medication that we discussed many times, and it's always a popular questions in your NCLEX exam, and this is all about grapefruit. All right. So we know what is grapefruit for. Grapefruit is an appetite suppressant by itself. That is a herbal medication, right? But the problem is this grapefruit can increase the potency of some medications. That's the biggest issue there. But again, if you're going to think about it, the benefit of increasing the potency is actually good, right? But problem is the more you increase your milligrams that you're taking, the problem is higher percentage of side effects. So what will happen if you're taking calcium channel blockers? These are all select all that apply in your NCLEX exam. You have um, pilodipine, right? You have other medications that are stated here, Procardia, Norvasc. You also have your Calan, right? So Calan, Tegretol, Buspar, and Mivacor. All those are in your NCLEX exam. Select all that apply. And one of the things that you wanna add is amiodarone. Amiodarone, the one that we give to our patient with tachycardia in our ECG. All right? So amiodarone is also not allowed to be taken with grapefruit. So understand all those medications because they're all select all that apply. But again, dipine as ending of your generic name, that's easy to remember already. Then, but the sad part of your calcium channel blockers, you have verapamil as one of the common medication in your NCLEX exam. And that came out on my test as well. All right. So then you have Tegretol, carbamazepine, you have Buspirone, which is your Buspar, and you have your Lovastatin. Now, example in your test. What if the question says, which among of the following anti-cholesterol medication should be avoided with grapefruit? Everything is a statin, right? Because we know general application of grapefruit, you should not take or drink or eat any grapefruit when you're taking statin. Now, you have lovastatin. You have other statin medication. It's not only lovastatin, but we have a lot of generic names ending with statin. So the best answer that you have to look for is the lovastatin. Okay? If it is select all that apply, all the statins are correct. But if it's only one best statin that you have to include as the correct answer, you should choose the lovastatin or Mivacor. All right, so that's how you understand it. Because I can, like as we said, antidepressant medication. What food you should avoid? Tyramine. But then tyramine is focused in our textbook, not applicable to patients taking MAWIs. But again, what's the general concept to it? It is it is a stimulant, antidepressant stimulant. So if you're taking any antidepressant, you should avoid tyramine. But again, if they're only looking for one medication, then that will be MAWI. But if they're select all that apply and you cannot find MAWI in the choice, remember that tyramine is not allowed for antidepressant medication. Same concept. All right, that's what you're gonna apply in your NCLEX exam. You don't keep on looking where is that, but you have to look at it on a bigger picture. What are they asking for me? Is a general application or a specific application, right? Because general application, all the statins are correct answer for to avoid grapefruit. But again, there comes another question. All is statin, but I only have to choose one. I have to look for the lovastatin. Okay, so that's our herbal medications. Any question? All right, so remember, interactions is one of the most common questions in your NCLEX exam. Do not combine these medications, like as to say, calcium channel blocker and grapefruit. And that's always in your test. So remember those kind of questions. All right. So any questions so far? Otherwise,